Hey everyone, this is Mythan Abraham, physical therapist.
And I'm Jared Einhorn, physical therapist.
So as we know, some of the complications related to COVID-19 are shortness of breath and breathing issues that can rapidly decline into pneumonia and other complications.
So yeah, with that being said, we just wanted to create a video going over some simple at-home breathing techniques that can not only help, your breathing and lungs, but also reduce stress in these kind of hard times.
Keep in mind that these exercises and techniques that we're showing you are preventative measures, can be used for patients with milder symptoms, or if you're asymptomatic and would like to keep your lungs strong and healthy during this time.
It's important to note that if you are seeing a worsening of your symptoms, such as a really bad cough, shortness of breath, or even chest tightness, it's crucial that you seek medical attention. All right, so the first breathing technique I'm going to go over is called pursed lip breathing. Pursed lip breathing is super effective for your patients with chronic obstructive pulmonary disease or COPD, especially if they've been affected by coronavirus as well. Now, pursed lip breathing, the classic technique is smell the roses, blow out the candles. To do this, what you're going to do is take a deep breath in through the nose, and then you're going to exhale or breathe out with pursed lips like you're blowing out candles. It's hard to see with my mask on, but once again, you're just taking a deep breath into the nose and out through the mouth with pursed lips. Okay, you can do this 10 to 15 times.
Alright guys, so the next exercise we're going to go over is diaphragmatic breathing, also known as abdominal breathing. This is to work on strengthening your diaphragm muscles, which is located right between your chest and your abdominal cavity, and is one of the main muscles that you use for breathing. And by strengthening this muscle, you can breathe more efficiently, and it also allows you to take deeper breaths, which is shown to have good beneficial effects such as reducing your heart rate, reducing blood pressure, reducing any stress, and also improving immune responses to potential infections. So the way that we're going to do this, I'm going to demonstrate. You're going to place one hand on your chest and one hand on your stomach. Okay, you want to take a deep breath in through your nose, hold it for about 5 seconds, and then blow out using pursed lip technique. So I'm going to demonstrate. Okay, so while you're taking that deep breath in, you really want to feel this bottom hand expanding, so your stomach expanding, allowing you to take more air into your lungs. You can also place your hands here at your sides as well and do the same technique, this time pushing your hands out to the side, expanding your rib cage. Okay, and then blow out. Okay, so after you've done about 5 cycles in each position, you can then do a cough either into your elbow or into a shirt, preferably not into anyone's face, just to expel some of the extra air. We recommend doing these at least 2 to 3 times a day in order to maintain your respiratory health, whether you're having mild symptoms or if you're asymptomatic. Go.
All right, so similarly to what Mythan said, I'm just going to show the diaphragmatic breathing in a supine or semi-reclined position. So once again, we're going to have one hand on the chest, one hand on the stomach, and when I take a deep breath in, I'm going to make sure I'm watching my belly go towards the ceiling. So look. Once you get used to this, you can actually challenge your diaphragm by adding a weight. So you can put it over your stomach. Once you know how to do the belly breathing, you don't necessarily need to give yourself the cues anymore. So you can just try to do the belly breathing with resistance. Once again, you can take 20 minutes out of your day, even 15, to just practice these breathing techniques, and they're super effective.
Okay, so the next technique we're going to be going through, as Jared is demonstrating here, you're going to be laying on your stomach. This is sometimes referred to as the crocodile breathing technique, and the reason why this is so beneficial is because a lot of your lung tissue and airways are actually located here in your back. So by laying here on your stomach, what you're doing is you're allowing those airways to open up, allowing for better oxygenation and airflow of some of the larger regions of your lung here in the back. This is also a good position and a way to strengthen your diaphragmatic muscles. A lot of times when we get sick, we tend to kind of lay on our back for extended periods of time, and over time that can be harmful to our body because it closes down and restricts some of these airways, preventing oxygen to reaching the different parts of the lungs. making you more susceptible to lower respiratory infections like pneumonia. Again, we're going to kind of demonstrate this exercise with you today. So it's always important to do these exercises in different positions as well, making sure that you're moving around and that you're not laying in bed all day, again, lowering your risk of some of these infections. So the way that you're going to do this exercise, if you can see, you're going to place a couple of pillows right under the hip just to prop your hips up a little bit. Arms can be over the head, okay, like so. And then in this position, you're going to complete several cycles of deep breathing, at least 5 cycles in through the nose and then blow out through the mouth, just as we practiced. You can also have someone assist you with this exercise as well. So what the person can do, they can place 2 hands on just your mid-back here, and this is basically a cue. So what you want to be doing is you want to take a deep breath in and you want to push out against their hand, as Jared is going to demonstrate. Take a deep breath in. Okay, and you want to feel their hand rise and fall when you exhale. Okay, you can do about 5 cycles in this position. You can also switch it up to the side as well. Hold here, targeting your lateral ribs, and again you want to push out, expand the rib cage, push out against their hand. Okay, and exhale. You can do 5 cycles in this position. Once you're done, you can finish it off by coming and sitting up and doing a cough, either into your elbows or into a shirt, just to expel some of the excess air. Again, we recommend you do these at least 2 to 3 times a day. We hope these exercises help, and stay safe.